Madam, go.
A very good morning and a warm welcome to all. Myself, Tejaswini, Associate Professor, JSS College of Physiotherapy, welcome you all for the 9th day of International Webinar Series. Today, I'm here to introduce our eminent speaker, Dr. Jyoti Saboo. Dr. Jyoti Saboo is a doctor of physical therapy and certified yoga therapist currently in private practice in San Jose, California. She graduated from the physiotherapy program at Christian Medical College, Vellore, followed by completing her postgraduate diploma in physiotherapy from All India Institute of Physical Medicine and Rehabilitation. She subsequently completed her master's with a specialty in neurology from University of Southern California in Los Angeles, and then received her doctorate in physical therapy from Anterior University. Ma'am is a certified yoga therapist from International Association of Yoga Therapy and have been integrated her practice with yoga for many years. Her career has spanned for more than 32 years. On behalf of JSS College of Physiotherapy, we welcome you for this webinar series, ma'am. Over to you, ma'am.
Thank you, Tejaswini. I'm so honored to be here in front of all distinguished fellow professionals and physical therapy student and practitioners, and it's such an honor for me to be here, and it's a privilege for me to talk in this forum. So I really thank Kavita Raja for this opportunity. I'm really excited to talk to you about neurophysiology of yoga, because it is a topic that's really dear to my heart. I have been involved with yoga for many years during my professional career, and also personally I've been practicing yoga on and off. My first exposure to serious yoga really was when I was doing my PGDR in Bombay. It was known as Bombay then, Mumbai today. And I did a yoga course in the Santa Cruz, I think Yoga Institute in Santa Cruz, I believe. And that was really a fantastic course. And I really started like playing with it a little bit with my patients and with myself, practicing it. And I really thought I got really good results with it. So since then, I have never forgotten yoga in my practice, because physical therapy, I'm very much a clinician at heart, and having access to an amazing tool like yoga, I think has really benefited my patients, and it has really, I think, honed my skills as a physical therapist, and it has opened my mind to what's out there, anything to do with movement, anything to do with with the brain, really, which connects, which makes you move better and improves your quality of life, is part of what we do as physiotherapists. And so this is such a nice chance for me to kind of bring up some of the information that's been out there recently that people have discovered about how yoga impacts the brain. So, let's dive into it. My topic is the neurophysiological basis of yoga. So first question is, what is yoga? Now, I am talking to a bunch of, Indian professionals, so I'm sure that you all have been exposed to or experienced yoga at some time or the other. So I'm just going to read a very dry definition of yoga, and I hope the rest of my topic won't be this dry. But basically, according to Wikipedia, yoga is a group of physical, mental, and spiritual practices or disciplines which originated in ancient India. So we're still talking about it though, right? It's ancient. It's an ancient practice. So I want to go a little bit into its ancientness, and it's a little bit about the history. So yoga is a greater than 2,000-year-old practice. Actually, it is more like 5,000 years. And the fundamental text on yoga was written by sage Patanjali. He wrote the Yoga Sutras. This is a treatise on the philosophy and the practice of yoga. it was created, he created this by synthesizing and organizing knowledge about this practice from older traditions. Now, the thing about this book is you would think it'll be one of those, book full of shlokas and, old written in Sanskrit, old Vedic text. Well, it is a Vedic text and it is a very exciting Vedic text, actually. It is very succinct. Everything in it is so beautifully described, and it's succinct at the same time. It is a detailed description about the philosophy, the principles, and the practice of yoga. Now, so yoga, Patanjali, it is postulated that Patanjali wrote the Yoga Sutras about 2000 years ago, or somewhere between 200 BCE or a little bit after. But it was followed by a few important yoga texts. Again, ancient history. It's not, this was also, way back then. So the practice of yoga since Patanjali continued to flourish in India, and there was a lot of, information added on. So the Yoga Bhasya is another book written by, they're not sure who wrote it, either sage Patanjali or sage Vyasa. Now, the other book on yoga is actually considered to be the Bhagavad Gita, the famous Bhagavad Gita, which is followed, for its philosophy, has also a lot of information on the philosophy of yoga. And this was attributed to sage Vyasa, who originally wrote the Mahabharata. The last ancient book that was written on yoga was by Swami Swatmarama, and that was called Hatha Yoga Pradipika, which talked a lot about really the physical. He espoused on the physical practices of yoga, the asanas, the pranayamas, the bandhas. So he did a few more. He went a little bit deeper into the practical aspect of yoga. Now, modern yoga. So what really happened after that is there was this quiet period, this hiatus that was about 700 years on yoga practice. And it was probably because India at that time was being invaded by all kinds of foreigners. So the whole Vedic, civilization and the Vedic literature and culture was being very suppressed at that time. And eventually it got reintroduced to the modern world by Swami Vivekananda. And when I say modern world, really the Western world, but it got a lot of attention, in the late 19th century, when it took the Western world by storm. It really created a big ruckus in the Western system. They used to think yoga was this mystic, snake charmer kind of thing, and they did not realize the deep thought process and the deep science behind this, this amazing practice. Today, yoga is practiced and acknowledged by millions around the world, but it still remains rooted in the 2000-year-old Yoga Sutras of Patanjali. So you ask, why is Patanjali relevant today? I mean, he's dead and gone a while. Okay, it is because the root of yoga as it is understood today is really born from the Yoga Sutras of Patanjali. This is the ultimate theoretical and philosophical go-to manual of yoga. Even today, people are going to be pulling out the sutras out of all kinds of places of the, from this text and connecting it to the yoga, to their yoga practice. It connects us to why we practice yoga. It gives meaning to why we do yoga, and it gives you can do so with the clarity of goal in mind, a very clear goal. It creates a framework within which yoga works. The yogic concepts in this book are described with logic, with objectivity, and with discernment. This language is so clear and precise and really short and cryptic. This is recognized as a fundamental, classic, and highly respected treatise on the subject by top scientists of the world. So anybody who's really claiming to be using yoga in some kind of way or practicing yoga, I really think that this is a great book to kind of get familiar with at least a little bit of it, just the beginning part of it, just to get a feel for why we are doing yoga and how and its relevance to our to really our body and our mind. So with that, I want to quickly touch on Patanjali Yoga Sutras. Of course, I'm not going to go through all of them. The Patanjali Yoga Sutra has 196 sutras or aphorisms. These are basically statements that he made, which is very, very loaded. They're like every word in this statement means like a million things. And of course, it has a lot of interpretation. This is divided into 4 chapters in the book, in the textbook. The Samadhi Pada is on concentration and preparation. Sadhana Pada is the actual practice. The Vibhuti Pada is about the experiential part of yoga. And then the Kaivalya Pada is the absolute freedom, going towards the self-realization goal, the ultimate goal. So some of the basic relevant sutras are, for example, Sutra 1.2 is very well known. And this basically tells us what yoga does. According to Patanjali, yoga chitta vritti nirodha. He says that yoga is a practice that helps to steady the fluctuating mind and bring about calmness. Now, this leads to the next sutra, the 1.3, which says, Tada drushtuhu swarupe avasthanam. And what he says over there is that is when you can achieve self-realization. So basically what he's saying is when you are able to steady your mind and keep your mind calm, that's when you can delve deeper into the mind and into the consciousness. And that's when you will be able to see yourself. So in other words, this whole practice of yoga that we do is really geared towards ultimately helping you keep your mind in a very steady, in a very steady state, so that you can start really getting into the deeper part of your mind. And that's the goal. Yoga Sutra 1.35 says, and now I don't know if I can read this very well. I did study Sanskrit in school actually, but I don't know my pronunciation anymore. So Vishayavat va pravritti rutpana manasaha sthitini bandhin. According to Patanjali, to reach the goal of self-realization, it doesn't just come. You have to work towards it. Like anything else in life, it's a step-by-step process. So one needs discipline, practice, and conviction. One needs to focus the mind on specific sensory perceptions and areas, and this can eventually help bring steadiness to the mind. Yoga Sutra 2.29 puts, talks about yoga like in a nutshell. And this is where Patanjali describes his Ashtanga yoga, which is the eight limbs of yoga. And these 8 limbs are yama, niyama. Yama and niyama have to do with the ethical codes of conduct and codes of restraint. One is how to take care of yourself, keeping your body clean, keeping your mind free of bad thoughts. So one has to do with your own self, cleansing in a way. And niyama is how one behaves with the world, the rules and observances, like similar to, you would say, like the 10 commandments from the Bible, right? The next is the asanas and the pranayamas. These are the physical practices of yoga, which are the most common. And asanas, of course, includes the getting in and out, the transitions into the postures, transitions out of the postures. And there's just a whole huge, this is just a whole huge realm of yoga, which, of course, I think it makes sense for us as physical therapists to be familiar with. But it's not just asanas. Asanas, as you see, is such a small, tiny part of yoga. Pranayamas are the ones have to do with, of course, the breath and the prana, or the breath, expansion of the breath, regulation and control of the breath. And they do have different pranayama practices that are meant to do different things. And once again, a fantastic science that has been developed years and years ago. So these are the two physical practices. The rest of them, the pratyahara is withdrawal of the senses, where you start bringing your attention inwards inside the body. Dharana is the concentration on a single focus, very focused. And then dhyana is a meditation where you are able to meditate and take everything around and still be able to, be calm in your meditative state. The final part of Ashtanga Yoga is Samadhi, which, again is interpreted in different ways, but basically it is reaching that highest state of the mind where one attains self-realization and, maybe moksha. So, modern yoga practice, let's talk a little bit about that. So do we really follow these 8 principles? Actually, in most of the yoga schools, they do cover all the Ashtanga Yoga, all the 8 limbs of yoga. And there's a lot of information in yoga, Patanjali's Yoga Sutras and about all of these. So 500 million people today practice yoga all over the world. It is the essence of modern yoga is still linked foundationally with the 2000-year-old Patanjali's Yoga Sutras. In general, today's yoga combines in varying degrees the following: asanas, pranayamas, and meditative practices. So they can, some are more asana heavy, some are more, some lean more towards meditation. And of course, focus a little bit more on breathing, or they use breath in both physical practices and meditative practices. So let's talk about the uniqueness of yoga. What makes yoga different from some of the other practice? Well, yoga is a mind-body practice. It employs mindfulness, attention, intention, timing, and quality of excursion. Yoga harnesses and explores the power of breathing to its fullest. This practice is refined and improved upon incrementally by the individual person. So you start at a certain level, you gain a certain knowledge about your body, and you build on that and you start improving on that. It is a holistic practice. It affects the mental, physical, and spiritual health of practitioners. So let's now dive into the meat of our of the lecture, and that is some neuroanatomical concepts and neurophysiological concepts relevant to yoga. So in the next few slides, I'm going to be talking about the 8 senses. I'm going to be talking about introspection and insula, anterior cingulate cortex, the autonomic nervous system, and the vagus nerve, the polyvagal theory, which I think you had Bala Pillai talked about it a little while ago, I think, for you guys. The HPA axis. We'll a little bit touch upon neurotransmitters, GABA, acetylcholine, dopamine, serotonin, and oxytocin, but not a whole lot. And then finally, we'll get into the top-down and the bottom-up theory. So 8 senses. Well, we always thought there were 5 senses, right? Well, wrong. There are 8 senses. The first 5 are sight, smell, touch, auditory, and taste that we get from the external world. They're called Interoceptors, and they are processed in the somatosensory cortex of the brain. Right. So I have not really talked. I have not really talked about the whole anatomy of the brain. I'm just assuming we have that basic knowledge as physical therapists about, the basic brain anatomy. Then we have the movement and positional sensors, which are proprioception and vestibular senses. And these are also, this information is also processed in the somatosensory cortex. That's mix 7. And finally, sorry about that, the last sensation that we're going to talk about is interoception, where this information is processed in the insular cortex, which we will talk about in a few slides. And this concept of interoception is a very important concept in yoga. So let's talk about interoception, the 8th sense. What is interoception? This is a sensory system that provides information on the internal condition of the body. So this allows many sensations, like when you have a growling stomach, a dry mouth, a tense muscles, muscular effort or tickling inside, something's going on within the body. How does the body know? It is because interoceptors pick up these signals and send it to the brain. And then that part of the brain, there's a part of the brain that actually processes this information and then dispenses it to whoever needs it for whatever is to be done about that. So interoception, it actually helps to facilitate a unified, integrated, holistic response of the individual to the body, to the mind, and to the environment. So it really is a BME phenomenon, body, mind, and environment phenomenon. It isn't just involved in the intrinsic body mechanisms, because the intrinsic body mechanisms actually just do respond to external stimuli. So it's body, mind, and environment, and also to our thoughts. Interoception is also credited with creating body images that are current and present, that are dynamically changing. So right now I'm sitting here and talking to you, and my interoceptors are telling my brain about, giving my brain information about the position I'm sitting in, my voice, my modulation, how I feel, that kind of stuff. Now, after this is done, I'm going to go and lie down, and that's going to be a different body image that is formed. So it is a very current and dynamic thing that goes on with interoception. It's a dynamic sensor system. It produces a dynamic mapping of the body, and not just the body activities going on within the body, but even mapping of the brain, even your interpretation of what's going on. My stomach is growling, or my stomach is hurting, or my heart is, I'm feeling nervous. All of those perceptions come from inside, and that interpretation and processing is done via the interoceptors. So this interoception is essential to the bridging of top-down and bottom-up processing, which we'll talk about, down the road here. What are interoceptors? Interoceptors are nerve endings. They are, sensory neurons. They are basically mechano and chemoreceptors. So they basically actually respond to mechanical stretching and compression and stretching, and any mechanical pressures, they respond to that. And they are also chemoreceptors. They are sensitive to the carbon dioxide levels and different hormonal and chemical levels in the body and in the blood. These interoceptors mostly have unmyelinated nerve endings, which means they're slow. Unmyelinated C fibers, which are slow conducting fibers. And C fibers, even the nociceptors, the pain receptors, also happen to be unmyelinated nerve endings. They are mediated by the bidirectional parasympathetic nerves. Mostly the biggest of which and most prominent of which is the vagus nerve. But there are three other nerves. They are cranial nerves that are parasympathetic, and bidirectional means they are mixed nerves, sensory and motor nerves. They sense changes in blood pressure and blood chemistry. We talked about that a little bit. And they also sense any changes about events in the GI tract. Interestingly, the earlier research on interoceptors, people thought that interoceptors were only present in the viscera, in the organs. But recently, there's been a lot of research that has been done on fascia, and they're finding that fascia has a lot of interoceptors along with proprioceptors and nociceptors, which are the pain receptors. So we'll talk a little bit about that later. Processing and integration of interoceptive information occurs in the insula and the cingulate cortices. And I will show you, since I think as a physical therapist, I never learned about this. I didn't know, I didn't care. I don't know at that time even if people knew what the insula and cingulate was and what they did, but now we know so much more. So in the last 10 to 20 years, there's been a lot of research done in this area, and it's really exciting and fascinating stuff. So I'm so happy to talk about it a little bit. Now, dysfunction in interoception can end up creating a distorted body map and also chronic pain conditions. One, classic example of dysfunctional interoception could be phantom limb sensation, right? That internal sensation from that limb is not creating that current body image, and so that old the body is stuck with that old image of that limb that was cut probably, and that pain is keeping on, that is bothering that person. So it because there is no interoceptors in the missing limb, it's not sending out those impulses to the brain to create that body image. Now, fascia, we talked about fascia being an interoceptive organ, and I especially wanted to mention this because as physical therapists, we are doing all kinds of things to fascia. We move it and we press it and we pull it and we stretch it, and it's good to know what we're doing to the body. And so the fascia network is present all over the body. So fascia is not just the deep and superficial fascia that we learn about right in school. It kind of folds in and out of organs and around. It wraps around nerves and blood vessels and glands and everything. So fascia is really the most extensive sensory organ in the body. And the interesting thing is 80% of fascial nerve endings happen to be non-myelinated, connected to slow conducting C-type neurons. 80%. That means only 20% of fascia is of the fascial nerve endings are proprioceptive. That's kind of big, right? 80% are, and out of this 80% of the non-myelinated, 90% are interoceptors. Only 10% are nociceptors. So 90% of this 80%, that's a huge amount, I'm not going to do the math now, project to the insular cortex. So they have found anatomical connections from there to the insular cortex, and which is why we'll talk a little bit more about that later. So now the proprioceptors that are there in the fascia do not project to the insular cortex, they project to the somatosensory cortex, which is the main sensory processing area of the brain that we all learn about, right? When somebody has a stroke, we learn about that and how the somatosensory mapping is all messed up and stuff like that. That comes from proprioceptors. So again, interoceptive processing, where does this happen? The main organ that in the brain that does interoceptive processing is the insula. It's called insula or insular cortex, and this is that part of the brain. It's in the sylvian fissure or in the lateral fissure, which is buried deep in the folds of the lateral fissure between the frontal on one side, the temporal on one side, and the parietal. So it's really deep in there, just tucked deep in there. And this happens to have a strong connection to the limbic system, interestingly. So you have all these different sensations going to the insula, and then they go to the limbic system, which has to do with, memory. It has to do with emotional processing, and it has to do with autonomic function. So so it has strong connections, but it also has a lot of connections to the prefrontal cortex, where you're interpreting a lot of these things and making some executive decisions, and also connected to the parietal or the sensory motor cortex. Now, so this is involved in mapping somatic states. We talked about that. It is very much involved in body awareness, body image, and mapping. It's involved in sensory perception, pain perceptions, and even feelings. Feelings of joy and anger are to some extent processed over here, because that's the introspective, all the interoceptors come in, and that input is then processed as joy or anger. Interestingly, this is the part of the brain that makes a person able to rate pain scale. So or the amount of muscular exertion you had. So if you say you're doing moderate muscular exertion, then that's the part that kind of estimates that it's something what you're doing is moderate effort versus more than that, or a strong effort, that kind of stuff. So therefore, it's also involved in motor control and learning. The insula is involved in motor recovery after stroke. Feeling of fullness and thirsty. Loss of balance has been associated with this part, and they even say that developmental delays and social relationships are affected by something going on in this area, the insular cortex. Next we talk about is the Anterior Cingulate Cortex. This is in the deep part of the brain, and this is a tract-like gray matter that is right above the corpus callosum that connects the two parts of the brain. And this is believed to be involved in top-down and bottom-up stimuli. It assigns appropriate control to different parts of the brain. So it takes in some information and then it decides what goes where, connecting to the prefrontal, parietal, limbic system and the anterior part of the insula. It is involved with emotion and motivational information and also associated with motor planning. The gray matter and functional connectivity of the ACC has been shown to be highly influenced by yoga meditation techniques. So it actually increases. You see that the cingulate area is bigger in people who've been long-term practitioners of yoga. So let's talk about the autonomic nervous system. This is part of the central nervous system. It is largely unconscious part of the brain function, and it functions at a subcortical level. The main organ that kind of controls and integrates this function is the hypothalamus, which is also part of the limbic system, and it is the integrator for autonomic and bodily functions. Now these are regulated by integrated reflexes that go via the brainstem to the spinal cord and then to the organs. Hypothalamus receives the autonomic regulatory input from the limbic system. So it's actually part of the limbic system. So the autonomic nervous system is divided into three subsystems: sympathetic, parasympathetic, and enteric. Now the enteric nervous system is very poorly studied, and I don't know much about it, and I have not looked that much into it. It is supposed to be that part of the nervous system that resides in the gut, and that's why it's called the second brain. So let's talk about the sympathetic and the parasympathetic systems a little bit. Sympathetic system is called the fight and flight system. So if you look at this diagram here, I don't know if I can show you. So, okay, I don't know if you guys can see my cursor here, but you have the sympathetic nervous system. It comes via the ganglions, the preganglions, and then the preganglionic fibers and the postganglionic fibers. And these are the ganglions that sit alongside the spinal cord between T2 and L2, I believe. And these shoot out all these efferent and some afferent nerves to, what they do. The sympathetic function is it dilates the pupil, so inhibits the flow of saliva and does all of those things. I'm not going to read that. And then the parasympathetic, so this is the fight and flight system. It revs up the body to act and to mobilize itself to face some kind of danger. So you either fight the danger or you run away from the danger, and it helps you do that. And this system is designed to be a short time. It's only supposed to be happening for a short time. You're only supposed to be exposed to that stress for a short period where you fight or you escape it or you fight it, and then it is resolved, and then you come back to a state of homeostasis, and then the parasympathetic system kicks in. That is the rest, digest, and repair system. And once again, the parasympathetic kind of does sort of the opposite. It calms down the system. It allows you to, it allows people to empty their bladder and kind of do all of those functions where, which are slower. They're not like, you're not in a hurry to do this. The more non-urgent functions and more of the baseline stuff. So the vagus nerve. Definitely anybody practicing yoga and wanting to know what yoga does to the brain and how it does it needs to know about the vagus nerve. This vagus nerve is a major parasympathetic mixed nerve. So right now I'm going to mention before we go forward that there are three other parasympathetic nerves, the cranial nerves. Vagus nerve is the cranial nerve 10, and the oculomotor is 3. Then the facial nerve is 7. And gosh, I'm forgetting this. And then the glossopharyngeal nerves. These are also the other vagus nerves, other parasympathetic nerves, and they all originate from the brainstem, including the vagus nerve. Okay, so now going back to vagus nerve, it's a major parasympathetic mixed nerve. It's the longest cranial nerve that it's called the wandering nerve. Vagus means wandering because it meanders all throughout the body. It's like putting its nose into everybody's business inside the body. This contains highly myelinated A, lightly myelinated B, and unmyelinated C fibers. And the vagus nerve has about 80% afferent or sensory fibers and about 20% efferent fibers or motor fibers, and it has a huge amount of interoceptors. The sensory component of this provides visceral sensation information for the larynx, esophagus, lungs, trachea, heart, and most of the digestive tract and the liver. Motor component, the pharynx, larynx, soft palate, heart, and the digestive tract. Now, there is this concept called high vagal tone. I'll talk a little bit more about it. And basically, a high vagal tone indicates increased activity of the vagus nerve. And increased activity of the vagus nerve activates the relaxation response, rest, digest, and repair response. Now, it also helps with regulating blood glucose levels, reducing the likelihood of diabetes. If you're a person with high vagal tone for most of the time, the likelihood of diabetes, stroke, and cardiovascular disease is less. Now, low vagal tone is actually has been associated mostly with chronic inflammation and chronic inflammatory conditions. Vagus nerve function, it has
ma'am, sorry to interrupt you.
Yeah.
Ma'am, your video is off. Can you please switch it on?
Okay. Video is off. Let's see. You can see my slides though, right?
Yeah, I can see your slides.
Okay, so let me do this.
Okay, sure.
Video. Why is my video off? Oh,
yeah.
Okay.
Yeah.
All right.
Yeah, now I get it. Now go back to your PPT.
Okay, are we good?
Yeah, good.
Okay, good. So we're talking about. Sorry about that disruption. We're talking about vagus nerve function, and it plays a central role in coordinating the relaxation response. We talked about that. It helps to decrease the breathing and heart rate and promote relaxation. It stimulates digestion and brings about a sense of calm. It also releases acetylcholine, which again regulates and reduces inflammation. Now there's another term over here that I'm going to throw at you guys, and that is it increases the heart rate variability, which is an indicator of stress levels and indicator of autonomic nervous system activity. And what heart rate variability in a nutshell is that it is the time between two heartbeats. So if you look at the ECG, it's usually calculated. It is an actual thing. It's actually calculated by cardiologists and stuff to see how active your ANS system is, if you're more parasympathetic or more sympathetically inclined. And this one is it's the distance between R and R in the PQRS in the waveforms of the heart. The vagus nerve stimulates immune response, and the very important part about the vagus nerve over here is that it is a major carrier of interoceptor signals, and this can then improve the mindfulness and body awareness part. High vagal tone, again, we talked about this. High vagal tone is high activity of the vagus, and that is a desirable state to be in. And usually this is associated with the lower heart rate, increased heart rate variability. We already talked about that. Now it is associated with healthy stress response. So it's not like you're not going to have any stress in life. That would be too boring, right? So you do need stress, but you can have a healthy stress response. And so it helps to get you into healthy and functional hybrid states. And we'll talk a little bit about that later. is involved with inhibition of abnormal sympathetic or dorsal vagal complex response. Now, what is dorsal vagal complex? And that is something that I think Bala Pillai probably talked to you about in the polyvagal theory. And I'll talk about that very briefly. I'm not going to go deep into that. So it has an inhibitory effect on abnormal responses to stress. Regulates the HPA axis. This is another buzzword that we should know. The hypothalamic pituitary adrenal axis. It's basically a neuroendocrinal system of dealing with stress. And we'll touch upon that. Interoceptive activation of the vagus provides a beneficial feedback loop that can have long-term physical, mental and physiological health benefits, which are positive, of course. They have found that yoga actually can activate the vagus nerve almost quite directly by its various practices. The physical and the breathing practices actually has an impact on the vagus nerve, which then, that's our link. That's the mind-body connection right there. Relaxation response is a physical state of relaxation that engages the parasympathetic nervous system. So it is a helpful way. This response is a helpful way to turn off the sympathetic fight or flight response and bring back the body to pre-stress levels. So that whole process is called allostasis. And allostasis is a process where the body comes back to homeostasis and it comes back to its baseline calm state. The regular use of relaxation response actually has been shown to help a lot of health problems that are exacerbated by chronic stress. Fibromyalgia, migraines, maybe some immune conditions, IBS, all of that can be affected to some extent by relaxation response. Yoga actually has powerful techniques that include interoceptive visualization and breath techniques that can actually elicit a very good relaxation response. Like the Shavasana, for example, of yoga is supposed to induce a very, very good relaxation response and release a lot of good chemicals into the blood. Polyvagal theory, Dr. Bala Pillai, I think, talked about this earlier. And basically what this is I'm going to really quickly go through this. It's an evolutionary model of how the vagal pathways respond to stressful and novel external stimuli. So it's an evolutionary model. So basically this was proposed by Dr. Stephen Porges. Now, basically what Dr. Porges says is there are two vagal systems that behave differently. There's the dorsal vagal system and there's the ventral vagal system. The ventral vagal system has to do with social engagement, and it's sort of the safety area. If you feel safe in that area, it has to do with feeling grounded and compassionate and mindful. So that's this green zone over here. That's the ventral vagal system. The dorsal vagal system is this red zone over here, and this is supposed to be a more primitive path that leads. So when you are exposed to like extreme danger, then the body shuts down completely, and or like it's supposed to be more for reptilian response, and where it leads to fainting and freezing or playing dead when threatened. So each of these adaptive responses are inhibitory in nature, because what happens with the dorsal vagal is it makes your muscles go flaccid. You kind of just get paralyzed in a flaccid way, just can't move. And so it's inhibitory in, people, and they say that, that's why it releases the bladder and the bowel and stuff like that. So but the ventral vagal system is considered to be a more evolved branch and they say that when that when the more evolved branch fails to act in a particular stressful situation, then we revert to the dorsal, the freeze and the fainting part of the dorsal vagal system. That kicks into gear. And in the middle over here is the sympathetic system. And we'll talk a little bit about that too. That's a fight or flight. That's also a response to stress. So quickly talking about unsafe and safe states. So there's this concept of states being, your reaction to feeling of safety and not being safe. So once again, the polyvagal theory here, it talks about the system, which is the ventral vagal system over here. It can also act in a way which is not safe, where somebody is, having passive aggressive behaviors or manipulation or lying. That's also a social engagement system, but it's a little bit more in the negative realm, versus a more positive realm is where you're engaging very nicely and socially with people and you're feeling very relaxed and safe. The sympathetic system can also be in the safe and unsafe zone. The unsafe is when when there is when there's a real danger, the sympathetic system goes into gear and there's a fight, flight, or hide response. And the sympathetic system is a mobilization system. It mobilizes things. So when you're in the happy part of the sympathetic system, you are dancing and doing yoga or doing work, and that's the system which allows you to move, but in a where you feel really safe. So it's a hybrid. It's a little bit of vagal, and it's a balance between too much of not too much of vagus and vagal system, and not too much of the sympathetic system kicking in. And then finally, the dorsal vagal system. You have the life-threatening, the unsafe, where you freeze and you dissociate with that particular situation, and versus you can get into this really resting state. You can get into the shavasana meditation state, which has to have some of the dorsal vagal system also kind of activated for all of that to be allowed to happen. Neuroendocrine response to stress. I want to talk a little bit about the HPA axis. Basically, when there's a stressor, the hypothalamus over here is triggered, and what that does, it releases a hormone called CRH, corticotropin releasing hormone, that goes to that affects the pituitary gland that is right below it, and from that the pituitary then secretes the ACTH, which is then goes and stimulates the adrenal cortex. And once the adrenal cortex is stimulated, it releases glucocorticoids in the blood, which are the cortisols, which are the classic stress hormones. So you have a bunch of cortisols circulating in your body as long as you're feeling stressed, and the de-stressed condition, you have less cortisol. Similarly, the other part of the stress response, the hypothalamus sends nerve impulses through the spinal cord to the adrenal medulla, and that then releases catecholamines, or the epinephrine and norepinephrine, which is basically adrenaline, is released, where you get to run or fight or do those things, where you have physiological phenomena that happen, like increasing the heart rate, blood pressure, glycogen being converted to glucose, so you have the energy to do whatever you have to do, and there's a changes in blood flow patterns because you need more blood in your muscles and less blood for digestion at that time. This is the HPA axis. Again, normal versus chronic stress response. When there's a stressful event.
Jyoti, interruption.
Yeah.
You're not visible again.
Oh, I don't know why that's happening. Okay. Let me go back there and there. Huh.
Yeah.
Okay. Better?
Yeah, fine. Thank you.
Okay, thanks. All right, I'm going back to this. The chronic stress response. A stressful event causes a little disruption in the systems, and then there's a natural adaptation, and then after that it goes back to physiological stability or homeostasis, and that process is called allostasis. Now, an uncommon or chronic stress response, what happens is this whole stress response is dysfunctional, and you get an abnormal response from which then increases the allostatic load, which means that homeostasis doesn't happen. And when homeostasis doesn't happen, there is no balance. And when there is an imbalance, that feedback goes back, and then the brain goes crazy and it goes into a vicious cycle from there. So yoga can reduce stress by increasing the parasympathetic activity and inhibiting abnormal stress responses. That is usually mediated by the sympathetic nervous system and sometimes in extreme cases by the dorsal vagal system. And of course, we know that with chronic stress, we deal a lot with patients with the chronic stress as physiotherapists, right? With chronic conditions, which may come about from chronic stress, headaches, or people with chronic pain, and stuff like that. That we also have to be aware of these phenomena and try to even integrate this into our practice. So limbic system, I won't go too deep into this, but this is the integral system that processes information related to emotions, motivational behavior, regulating autonomic and endocrine systems, and also consolidating memories. These are some parts of the limbic system, not all of it. The hippocampus, it plays a big role in emotion, learning, and memory. The amygdala is the bad boy of the brain. And this bad boy of the brain, it tends to play a role in aggression and eating and drinking and deviant sexual behaviors, and also things like addictive behaviors. The hypothalamus monitors blood levels and is responsible for homeostasis of the blood levels of glucose and other electrolytes and blood pressure and also the hormonal levels in the brain. So all of these, and the thalamus is also a part of the limbic system, so is the olfactory bulb. So the limbic system in general has to do with emotions and behaviors and memory. And they are very closely connected to the insula and the anterior cingulate that we talked about, and also of course to the prefrontal cortex. So this is an overall picture of some of the parts of the brain that have to do with, I guess, with the practice of yoga and how some of these are affected. So we have the cortical areas, we have the somatosensory cortex, we have the prefrontal area, and we have the motor or the premotor cortex. That's the topmost. And then the other cortical areas are the insula and the anterior cingulate. They're also there. And when you see all of these connections, there are like tons of connections everywhere. Everything connects to everything else in both ways. Sometimes one way, sometimes it's both ways. So the proprioceptors and the exteroceptors that we talked about, they all are processed in the somatosensory cortex right there. The interoceptors from the fascia, sorry about that, and the interoceptors from the viscera coming through the parasympathetic nerves, they go via the brainstem, they go to the insula, and they are processed over there. The limbic system is the thalamus, the hypothalamus, the amygdala, and the hippocampus. They are the deepest parts of the brain, and they play a role they give a lot of information to the rest of the body. Some of the responses are automatic, and some of the responses are modulated by the higher brain centers. And again, you have the HPA axis over here, hypothalamus, pituitary, adrenal cortex, and then the sympathetic nervous system going to the adrenal medulla. Want to talk a little bit about the modern yoga research and scientific methods that have been used to study the brain. So there have been a lot of neuroimaging. Neuroimaging has really exploded in this last few years, and it is really astounding that this 2,000-year-old practice today, that is alive and thriving today, and its efficacy is now being proven by use of these modern research methodologies. So some of the methodologies that they use to study the brain and the effect of yoga on the brain have been EEGs, functional MRIs that look at the blood flow to different parts of the brain and it lights up, MRIs, SPECT, PET, DTI, I'm not quite sure what that is actually, and then Also, they study the different levels of hormones in the body that affect the brain and neurological function. And there have been some epigenetic studies to see how gene expression is changed and influenced by yoga. There have been a lot of clinical research that has been done, and lots and lots, tons of clinical research have been done on the clinical and functional effects of yoga. And while the abundance of research, there's a lot of it, somehow the you know, differentiating the wheat from the chaff has been hard, because um, it's really hard to do a really good robust study on yoga practice, because because of the multivariate nature of the yoga practices. So if you look, somebody follows Kundalini yoga, somebody follows Iyengar yoga, or there's the Vinyasa yoga. There's just like tons of yoga schools that focus on different things. So all of yoga practice is not really standardized. That's a problem, actually, because then it's really hard to study. And then the multivariate ways it affects the body. So, it's affecting the body in different ways, physiologically, mentally, physically. And then how do you know something else is not being thrown into that? So those kind of studies are really hard to really control, all these different variances that are there in the studies. Also, they say that linking causation to intervention is difficult, especially when the intervention is a lifestyle, because yoga is a lifestyle change, really. Now, the proven effects of yoga that have been found from these studies, from neuroimaging studies and some other studies have, that these are the following. It has been shown to increase the intra-insular connectivity in yoga subjects. The cerebral blood flow has been shown to increase. There's been increased neural activation and cerebral blood flow in the frontal regions during yoga meditation. Scientists have found increased functional connectivity in the prefrontal areas of the brain, which is the area of the higher thinking areas, the decision-making areas. Then there's been increased GABA and dopamine levels and decreased brain metabolites, which are associated with decreased inflammation and decreased stress levels. And these have been documented in studies. So there've been a couple of studies that were done recently, which were systematic reviews. They were just literature reviews. One was done very recently this year, and another one I think was done last year. And these ones have kind of tried to get together all the valid studies that they have found in the literature and try to summarize what they found. And what they have found is that there has been relatively consistent cerebral structural and functional changes associated with yoga. And they feel like this may be associated with the beneficial effects that they have found in the clinical research studies of the physical. So these areas of the brain that they found sort of correspond with the physical and psychological effects that they have seen after yoga practice, the functional effects. They found an increase in regional gray matter density and volume in yoga practitioners, mostly in the frontal cortex, in the hippocampus, which has to do with memory. Frontal cortex, of course, has to do with higher thinking, higher level functions. Anterior cingulate cortex and insula, which has to do with the awareness and mindfulness and motor learning. Yoga may induce an increase in the functional connectivity between the insula and the brain regions. They have seen that, and they have been involved. It's been involved in the regulation of affective and sensory processing. Again, increased GABA levels have been shown to be a result of the increased parasympathetic and vagal stimulation. Yoga studies suggested there's an analysis that says that there's increased amount of this substance called BDNF levels, which is a marker for neuroplasticity. And they have found this, I think they found this in the hippocampus. And interestingly enough, they have found that Om chanting has a significant vagal effect. So don't forget your Oms. And then vagal effect. Some other studies have shown that, again, aging studies have actually shown there's less cortical thinning in the prefrontal cortex. That means people, long-term practitioners of yoga, can retain their upstairs a little bit better. Increased GMV in the prefrontal cortex again, and the limbic system. So they process emotion and memory better because they've shown and this is shown by the increased in the gray matter volume. They found that yoga might buffer against atrophy in the hippocampus, which means, it has implications maybe for Alzheimer's and stuff like that, where, memory and emotional regulation and information processing is an issue. Again, yoga practice was also associated with the reduction of the gray matter of the amygdala. If you remember, we talked about the amygdala being the bad boy, where it, big amygdala means deviant and bad behaviors, and so small amygdala means not such bad behaviors, apparently. Okay, so where are we? Effects of yoga. Some of the clinical studies, the empirical studies, and the literature reviews show that yoga helps to cultivate a positive frame of mind. It enhances areas of brain learning, memory, empathy, and compassion. Yogic practitioners can better endure stress and emotional intensity. It improves cognitive efficiency and emotional regulation. It can better process emotional experiences and negative experiences. Practitioners of yoga. It has been shown to reduce anxiety, prevent depression, and improve attention span and focus. Now, effects of yoga on physical health. Of course, it does. It's kind of, some of this is obvious, right, to us. It increases flexibility, muscle strength, and endurance, improves posture, balance, and vestibular function. It helps to smoothen movements and improve the efficiency of movement excursion. It improves movement and sports performance. And eutomy. Eutomy is a term there where the modulation of the tone can happen, or of muscle tone can happen just with yoga practices. You can kind of tense up a certain muscle and soften it up based on, and modulate it so that you can also get a very nice, smooth movement going in that area. Improves body awareness. It improves ocular responses. There is part of yoga called the tratakas that has to do actually with yoga, with eye exercises, and it is shown to reduce pain, chronic pain. Effects of yoga on bodily function has, of course, parasympathetic division has been very clearly shown to activate the relaxation response, which then has this cascading effect of all good things happening, heart rate coming down, feeling good, everything being relaxed. It has proven cardiovascular benefits and improvement in sleep. So how does this work? That's the question, right? How does yoga affect the brain so profoundly? There is this theory that says that it does so by linking top-down and bottom-up processing. So what is top-down process? Top-down process is a neurocognitive mechanism, and basically it is initiated by attention. It is initiated in the higher centers of the brain. So it is initiated volitionally by attention, cognitive, and emotional intentionality. And Patanjali calls it sankalpa. That's the Sanskrit word for it. Sankalpa is you resolve, you have an intention to do something, and that's a clear intention that you have. So the top-down process impacts the neural pathways and the structure and function of the brain. It creates potential to reshape or create new neural pathways and networks that works to impact our health, healing, and well-being. And at the same time, it helps to fade out the non-desirable neural pathways by not being used that much. It decreases and modulates the HPA and sympathetic nervous system activity, and therefore it helps to improve immune function and inflammation. This is coming from top down. Just attention to breath, okay, brings about the bridge for the brain. Just attention to breath, just thinking about it, where you initiate it from, from your cortex. That's top down. Now, top down is connected also. It's a loop. It's connected to the bottom up processing. And this is a neurophysiological mechanism, whereas the top down is a neurocognitive mechanism. This is a neurophysiological mechanism. And this is facilitated by the outside input coming in to trigger the vagus nerve. Right, that's the biggest way, and there are also other proprioceptive, interoceptive input that we get from the external world that goes up and creates neurophysiological things to happen. So it works via the HPA and the PNS, SNS activity with changes in the immune system and functional, emotional well-being and adjustment of the autonomic function. And it also positively influences the musculoskeletal cardiovascular nervous system function. Again, we have that feedback loop that happens over here. So an example of this is the proprioceptive and interoceptive input from yogic breath and asana practice can go upwards towards the brain and influence things. And then it goes to a higher, thought process, and then it becomes a cycle. So once again, top-down processing, use of focused attention and effort, controlling thoughts and behaviors, and involves cognitive skills such as planning and goal setting, monitoring, inhibiting, and metacognition. Versus the bottoms up is the input of bodily sensation into our experience, and the input from the breath in the asana practice can affect. So this is a little schematic where it shows you have the frontoparietal control network, the higher centers, and then you have the lower centers of the brain, mainly the limbic system and of course the hypothalamus and the sympathetic, the autonomic nervous system is over here, is represented here. Subconscious level and conscious level. Subconscious level is affected by sensory inputs going in, and so when there's a stress response, you can get this according to the state of the brain. You have all of these inputs. It can have an inhibitory effect on these negative emotional rumination thought processes. Can come down, because just thinking sometimes can increase your blood pressure and your heart rate, right? So that then affects the stress response. So by using external yogic practices, we can influence, sorry about that, we can influence the brain, and the brain can also influence the practices that we do. It goes both ways. To summarize, the top-down is initiated by volition, interpreted using contextual clues, and uses previous experiences and expectations to form its pathways, to form its messages. The bottoms up is initiated by peripheral sensation. The bottom up is basically data driven, whereas the top is driven by previous memories and experiences, and then that's how the top down happens. Bottom up is from external input. It focuses on the incoming sensory data, and the bottom up takes part in real time. The top down not necessarily. It's a little bit more, can be a little bit more planned. Implications of yoga's effect on the central nervous system. Again, it improves attention to interoceptors, mindfulness, resulting in improved awareness of body states and function at the cortical and subcortical levels, right? So the interoceptive, I think one of the important things to understand about how yoga works, I think, is through the interoceptors, the mindfulness, that internal feeling that it becomes enhanced. It becomes more sensitive to the internal working of the body. So that way you can make more changes in the body when there's more interoceptive activity going on. So it can form current and accurate body maps and images, not a distorted body image. And that way we can get improved decision making and responses from the higher centers. And this way you can optimize brain control of both the conscious levels and also to some extent the automatic functions. Emphasis on breath synchronization and breathing techniques can enhance and optimize the functioning of the autonomic nervous system via the parasympathetic link, and specifically the vagal nerve, vagal activation. Again, consistency, mindfulness, and repetition of the yoga practice can forge healthy neural pathways and can allow the older and more harmful neural pathways to fade away, resulting in beneficial effect of neuroplasticity. And by focusing on the parasympathetic activation, there's more healing and repair. You spend more time in the healing and repair state in the body, so that the body has adequate time to do mental, physical, and physiological healing, reduction of inflammation, and enhancement of well-being. So, takeaway from this is that the beneficial account of yoga practice on health and well-being is undeniable. There's just a lack of studies, and there's just a lack of robust studies at this point. But it's happening, and I'm hoping that somebody in the audience, a few of you in the audience, will take up this challenge and work on this kind of stuff, right? The profound effect on the brain is becoming more and more apparent nowadays through research studies, and it is very apparent that more research is needed, more robust and good research, well-designed research projects are needed to validate this efficacy of yoga, because it's validated by word of mouth. But now we need to really prove it in a little bit more scientific way. Another takeaway, it's definitely a takeaway, is that yoga has a powerful practice, and it does influence brain function through the body and body function. It can decrease the allostatic load and help with homeostasis, has a powerful effect on thinking and mental, emotional processing, and of course physical performance. And a very good thing about that is it promotes mindfulness and cultivating interoception. So we should embrace yoga as a profession, right? It just makes so much sense in physical therapy for us to be embracing this and not ignoring it. I think sometimes we tend to ignore it because we feel we don't want to be associated with something that's mystic or voodoo. But I think the evidence is really out there now, more and more. And it's high time that we as a profession start looking into it and see how it can help us in our profession. Yoga continues to flourish as a wellness tool. And now it is evolving into this new field of yoga therapy, right? Which is becoming more of a preventive, restorative, and rehabilitative tool, which have very specific goals for treating specific conditions. And this field of yoga therapy is growing, and it's emerging as an adjunct to mainstream medical system. In fact, in a way, you could say it's actually beginning to be a rival for us. And I think if we don't jump on this bandwagon, we're going to miss out big time. Evolution of yoga therapy has, I think there's a very natural, it could be a very natural and symbiotic relationship to know about yoga and to be able to apply it where it is applicable, and apply even the concepts of yoga. So it's time for us to take this as a wonderful opportunity. And it's really, really, I think, as a scientific community, we should really work on validating what we want with modern research methodologies, all for the betterment of our patients and to uplift our science. Namaste.
Thank you so much, ma'am. It was a very effective, informative session.
Thank you.
Nowadays, like yoga and meditation is an emerging therapy, so which is going to be very effective in most of the conditions and also in our rehabilitation. So thank you so much. Ma'am, there are a few questions. Shall we go to the question?
Sure.
The first question How do we teach mindfulness to neuro patients?
You know, neuro patients it really depends on what specific neurological impairment they have, right? So if you get somebody with say who's had a stroke, right, and they've lost their body awareness, they've lost their body mapping system, they don't have that internal perception, right? So the thing is, the thing about doing that is, if you want to use yoga as a tool, you it's really important to do it repetitively and to do it consistently to make any impact, even in a normal person who's not compromised. So definitely in somebody who's compromised, we don't know which part of the brain has been compromised, but what we do know is there is this huge potential for neuroplasticity. So we shouldn't rule it out. Now, I don't know how it is in India anymore. I've kind of lost touch with that practice in India, but in the US, we are so constrained with insurance to continue to see patients for long term. So we end up being really limited by seeing patients for very short term. And so, you know, sometimes it's really hard to, because I think with the yoga, it really, you have to really get into that long term perspective. So as physical physiotherapists, maybe we don't have that much of a chance to do that, but then we could try to inspire that particular neuro patient to start practicing some, you know, some parts of yoga. And maybe if we have that knowledge of yoga, we can get them started on that path. We can show them some basic techniques, and then we can have them, you know, I know, like usually in the past, you know, yoga has always needed a guru, but maybe they could, you know, hire somebody who can come and work with them one-on-one. But if insurance is not an issue, if payment is not an issue, keeping that one patient on for a longer time, you might be able to make a good, make a slow and somewhat functional change. It really depends on what kind of neurological impairment there's been.
Does the yoga practice help with spasticity, ma'am? And if so, what kind of particular yoga practice you would suggest?
So spasticity comes from the brain. Something is going wrong with the brain, right? So if the person has spasticity, then it is almost like an automatic thing that happens that makes that tone go a certain way. But there are so many now, you know, there's so many approaches that where you try to inhibit certain things. So you can try to use yoga first as a you know, maybe you can try to use it as a meditative technique, in the sense, sit down and relax and teach them a good relaxation response where they can soften their muscles, and then they can start tuning into the interoceptive information a little bit more by allowing the brain to feel what's going on inside the body. And maybe because the brain really is a self-healing thing, the brain really, we don't really heal anything. We just trigger something that goes to the brain. And hopefully, if we're working with a person with spasticity and revving them up and making them go crazy and they're getting emotional and they're never going to get to be able to control the spasticity. But maybe we can teach them to focus on the breath. Maybe we can teach, and while they're focusing on the breath, we can ask them to, you know, look into their balance and look into their alignment and say, how do you feel? Do you feel you're aligned? So it makes them start tuning into those things. And maybe that is the way to approach a neurological patient, is getting them connected with their body, with somehow they lost that connection. So we can try to use either external, like the top down, bottoms up, we can try to use their mind and their intentional volitional process to calm things down, or we can try to use breath to see what we can get out of it.
Thank you, ma'am. Are there any particular yoga practice that can be tried for chronic pain?
Chronic pain is, you know, there was a study that was done, I don't remember when it was done, where they studied a bunch of people with thoracolumbar chronic pain. And they tried to see, they were expecting that all their neurons are firing away rapidly and they're getting this bad, really spastic response. And to their surprise, they found that all the nerve endings in that area were dead. There were no nerve endings, yet this patient was experiencing pain all the time. So it was more of a central pain. It's coming from the mind. So when a chronic pain situation comes, I don't know, doing only physical practices that we do, modalities, I think it has some limitations in what we do, but we can try to get these people into that different state of mind where they can teach themselves to be more calm, and maybe that will help them influence their pain perception, and maybe that will create a different body map for them, which will then affect, because it's very hard to treat central pain syndromes, which are chronic pain coming from the brain, where that connection between the body part and the brain has been broken. And so it just gets into this broken record, feeling like I have pain, but actually there's nothing there that's really causing the pain.
Okay, thank you, ma'am. There's another question. Can yoga be used in sports injury management?
Say that again?
Can yoga be used in sports injury?
Oh, absolutely, 100%. In fact, yoga should be used in sports injury. So if you injure just your ankle, right? The ankle has muscles and it has bones and it has tendons and it has fascia, and this fascia goes from the head to the toe. So if you only treat one part of fascia, there is the rest of it that you're really leaving untreated, which that might actually make that person more vulnerable to another injury. So you have to look at things like a kinetic chain, and you have to look at the fascial lines. And, like Tom Myers' Anatomy Trains is a great book about fascia and the body, and he looks at body anatomy very differently. He looks at this whole, going from the posterior fascial line, and along that whole fascia, he says there are this muscle is attached here, this muscle is attached there. So depending on which muscle is working, that whole fascial line is being affected. So some problem in the ankle, in the heel, can end up in the neck issue.
Okay. Ma'am, can pranayama be helpful for caregivers of people with disability?
Oh, absolutely. Caregivers, right? Think about it. Caregivers are this is the hardest job. And really getting that time to do a little bit of meditation and really getting into their bodies and doing some, so that would be a little bit more of a wellness, that because the caregivers are not directly PT patients, right? They're not directly our patients. They're the caregivers of our patients. So for them, to direct them to a proper yoga program or a yoga meditation program or something where they can take those breaks and they can understand the importance of doing that to stay sane and to continue to care for that patient with empathy. Yoga has been shown to improve empathy and compassion in people, and so that will make them maybe be better caregivers.
Thank you, ma'am. Ma'am, how do we assess whether the patients would benefit from yoga?
I don't know anybody who won't benefit from yoga, actually. I think the question should be, why will this person not benefit from yoga? That's the question.
Does yoga enhance immunity, ma'am?
Absolutely, it has been shown to enhance immunity, and not only does it have these neurophysiological ways it does that. Now recent research has been showing that yoga acts, with the breath, for example, acts at the epithelial levels, where the epithelium releases nitric oxide, which has a huge effect on improving inflammation. And they're finding that for example, when you do your pranayams through the nose, right? The nose linings is one of the parts that actually produces a lot of nitric oxide. And so by enhancing the anulom, vilom and different pranayams through the nose, people are actually recommending that a lot now during COVID to improve immunity.
Yeah. So same way, I think role of yoga in respiratory distress and anxiety will also be having an influence.
Exactly. Yeah. Asthma and, a lot of these are so psychosomatic, right? So with psychosomatic, because they have that, and it's a real thing. It's psychosomatic doesn't mean like, oh, this person's faking it. It's a very real thing. That's what their brain is perceiving. So trying to get them connected with their body, that's where the mindfulness part of yoga. So yoga has a physical aspect, which I think we can always leverage as physical therapists. We have to, and we should be leveraging it. I don't know why we wouldn't leverage that. But adding the breathing aspect, that even enhances what we do even more. And then, and then on top of that, if we can add the little bit of the relaxation and stuff like that, we're really going to get better results.
Ma'am, there's another question. How does yoga help in forming new neural pattern and breaking the old neural pattern?
So, I mean, it's postulated what they're seeing, the way they have found. So first of all, they have found that it's a thing now. They have found that with yoga, the connections between certain parts of the brain has been shown when they have, compared yoga people with non-yoga practitioners. They have found certain neural pathways are strengthened, they're stronger, even the connectivity is stronger, and even the gray matter volume is stronger. So what they're postulating is when the gray matter is stronger, the gray matter is only stronger because the connectivity is stronger. That means there are more neurons being laid, there are more fibers, axons being laid. That means the axons have to lead to neurons. You can't just have an axon just hanging there without a head. So, so that's how it's going to, so there has been shown that it does. So they say that long term, there have been some long-term studies of people who've been practicing yoga for a long time, and they have found that the neural plasticity, they have enhanced certain parts of the brain. And that's what neural plasticity is reshaping the brain based on the input and based on the demands on the brain. Right? But it's not going to happen in 2 days. It's going to happen only in people who do, well, maybe it will happen in 2 days. I don't know that if there is enough research about that, but definitely for long term, you have to be, even one of the Yoga Sutras, he talks about discipline. You need to put in the work. You need to put in the hard work, the consistency to see the results at the brain level, I think.
Ma'am, how is yoga relevant to brain matter volumes? Is it based on time of practice or type of yoga we do?
That much research hasn't been done, that much. But what they have found is that the top down and the bottoms up again. When you do yoga, you reduce your stress levels. When you reduce your stress levels, you have time to be more creative. You have time to think more. You have time to think good things. And then when the more of good things you do, the more of that part of the body that does those good things increases in volume. Right? So you have that connection of I think one of the big ways that yoga really helps is by helping you deal with stress in a much more balanced way and not going crazy, not going into that vicious cycle of chronic stress and vicious cycle of chronic inflammation. If it can, of course, it's the biggest value in yoga is preventive. I think more than actually being healing. Healing, there still has to be much more studies about the healing part of yoga, but it has been shown to reduce inflammation. But so that's the mechanism. It's probably through the vagal, high vagal tone, and better immune responses.
This is the last question. What would you suggest for increasing the metacognition in physiotherapists?
In physiotherapists, stand on your head every day. I don't know. I think go do some yoga courses. get certified, go become really, I really mean it. I think I really feel like having yoga, as a curriculum will really benefit the profession. And trying to, just doing it, and then we don't want to subscribe. We have to distinguish ourselves as a profession. We want to be perceived as, being science, evidence-based and science-based, right? So we don't want to be anecdotal based. So we really have to do it in a way, it's a little bit tricky, right? But I think if you have the resources to be able to come up with some studies and be very specific with what you're doing and really design a good study, and I think we need more research out there. And we need it, and I think we are a very good profession, because everybody is doing physical yoga these days. It's all, the meditative yoga, of course, is there, but really you see everybody is doing aerial yoga, hot yoga, hang yoga, this yoga, that yoga. It's all movement and, physical based. So we can get a lot of clients who get injured doing yoga, right? But it's good for us to know also, and it's good for us to know what are some safe practices in yoga. We should start looking at the physical part too, and saying, if you improve the mindfulness when you're doing actual yoga, when you're doing your actual exercises, I think we'll get a better result from that. And that comes from, so yoga, not just looking at yoga as a physical practice, but even looking at the mindfulness and the breathing of yoga, we can definitely harness that. I do that. I work with hospice people. So even when I see hospice cases, I will, teach them to put their hand on their stomach, and I'll teach them simple abdominal breathing, just so they can try to be present, because they're so, they're just so freaked out by their condition. They're so stressed. They can't even experience life, and they can't see beauty anywhere. And sometimes getting them to bring that down, as physical therapists, we spend a lot of time with our patients. We're almost like psychologists sometimes, aren't we? We're chatting with our patients, finding out and giving them advice. So why not do yoga as part of that and stay there? It's part of healing. We're in the healing profession. I think it's very relevant to what we do.
Thank you so much, Ma. It was a very informative session. Thank you so much.
Good.
Jyoti, I have some questions.
Yeah, I was waiting for that.
What's that?
I was waiting. I was wondering.
See, if we have to do research on yoga, we have to have certain concepts, right? You can't say yoga, because it is an entire philosophy by itself. You can't say I'm doing research on physiotherapy. You have to have a particular thing. So, for example, now we have a we have a rehab center of which I'm head. So we have a lot of spinal cord injury patients, for example, and we have CP patients and we have stroke patients. So now in this spinal cord injury patients, for example, if we were to, do bubble bladder training, do you think mindfulness would be something that we could study?
If the actual connections are gone, and it's a peripheral nerve connection that's gone, right? Say
Yeah,
it's
about autonomic bladder, on the ones that we anyway do the training on. So would this be an additional, we are doing clamping the bladder, clamping the catheter and seeing how long and increasing the volume and all that. Would that, do you think it's
I don't know, because it's never been done. And if they don't have, it really depends on whether they have those sensory receptors working or not, right? So if you don't have sensory receptors that are working, if that whole connection has been cut off, is there, it's probably worth trying it out to say that, it didn't work. Because why? Because, and then you can postulate and say that because, what about maybe there's some alternate path we don't know about? Maybe there is more of a interoceptive path that, but even the interoceptive path is ultimately goes through nerves, right? So we don't know which nerve. So if that whole thing has been completely cut off, how long is it going to take for that neuroplasticity of the nerves? You know, there's neuroplasticity in the brain, and then there's neuroplasticity of the nerves growing too, right? And yeah, so who knows? It's, I don't know. It's something to, you know, maybe somebody, you can do a pilot study and see if there's any, and then, you know, it's really good to, if you have a good, well-designed pilot study, it's really good to even write about it and report it, because then it's kind of, you know, we tried this hoping, you know, and then we didn't find a difference. So it's at least recorded.
In your opinion, to start, if we were to start with any yogic practice, pranayama and mindfulness meditation are more important than asanas?
No, I think you have to learn. It depends on the patient and what they're doing. And sometimes you can do a breathing practice integrated with the movement practice that we're doing, right? Sometimes we want to learn, we want someone to improve their body awareness. Now, that would be a good study. Work on stroke patients, right? And I don't know how you would get the control group, but working on stroke patients and saying, you know, we had so many whatever left hammies who had this totally distorted pushing syndrome, and then we had these. So are they trainable? Are they, you know? And sometimes the problem might be that you only get to see the patient 3 times a week for 3 weeks. What after? And sometimes these changes may not necessarily happen that quick, right? Because changes, though, so the value in yoga for sure is a lot more preventive, but the healing part of yoga, there are so many questions out there.
No, we can see them for as long as we want. We don't have any insurance problems, no.
Oh, really? And and then no payment problems. So you'll get only the rich.
No payment problems, because we have an outreach service where we do it free of cost. So that's not an issue.
Oh, yeah. Then maybe, you know, seeing somebody 3 times a week for 3 months or 6 months, right? And then you know, you may end up having to do more for longitudinal study, because it's so hard to get a proper controlled thing unless you do a blinded randomized control study or something, and see these people didn't get it and these people did. With stroke patients, that's a really hard study to do. But, you know, it's certainly something to think about with other patients, or, you know, maybe you can have the students do some more research on, you know, autism, or, you know, learning disability cases, or, you know, on kids, even going to a school, and that may be easier to do, to document the effect of, you know, physical performance with and without yogic practices, which could be breathing practices or meditative practices.
Would you like to be an external advisor on that?
I don't know. Don't drag me into this too much, okay?
You're already in neck deep, so. No, actually, jokes apart, we have a school program that we run. Basically, we are looking at you know, movement disability. We are early identifying that kind of thing. But we could expand that to behavioral issues, and this might work, right?
Oh yeah, absolutely, yeah.
Children who are hyperactive, ADHD.
Oh, you should definitely talk to Bala.
Yeah, Bala will go into deep into polyvagal theory, and and then I'll get bored. So okay, so this might work.
Yeah.
So you're saying just pranayama should be should be a modality? No.
Not just pranayama. I think everything should be on the table.
So how do you choose the asanas? Based on biomechanics?
Yeah, you know, depends on what, if it's more of an orthopedic, you know, even orthopedic patients have neurological issues, right? Somehow their whole, the body image also gets distorted, right? So teaching them, you can just do only certain meditative postures, maybe before they do the exercises, to make them do the exercises properly. So they would have to really, I think everything should be on the table. Meditation, And by meditation, maybe just like quieting down the system and doing, maybe I would say, more of a relaxation response. I do that a lot on my patients. When I have, especially when I have a chronic pain patient, I actually sometimes I will start my session with getting them into a little bit of a shavasana type of position. I get them to do deep relaxation, and then I get them to really relax their bodies before I can work on them.
How do you decide the dosage? How many times a week? How many minutes? It's just, we don't know, right?
Yeah, we don't know. See,
We
these
don't
are
know
the
that.
things that have to be studied. And how many minutes of this should you do? You really don't know that. Now, nobody studied it. Nobody. It's not. There's nothing scientific in that.
Does Patanjali suggest anything?
Patanjali only says do. He actually hardly talks about asanas.
Okay.
He talks about the behavior. He describes behaviors, and he does. It's more of a neuropsychology text. That's like a deep neuropsychology text that he's written. The physical part of yoga really was developed later. And, if you ask me, people just add, it's such a man-made thing, right? People just added. So you can really, technically, you can call anything yoga as long as you put your, so it's not just on the asanas that are already defined. That's just one school of yoga has developed certain kind of movement patterns and they own it. And then Iyengar, everybody says Iyengar yoga is the yoga, or Vinyasa yoga is the yoga, or Bihar school of yoga. There are just so many yoga schools. They emphasize different things. So I think you can just but one of the things that that's common is it's more of a holistic practice, right? It does include like the long kinetic chains if you're looking at it biomechanically, and that's such a nice, connecting that to the fascial train, the anatomical trains of Tom Myers is such a different way of looking at the movement system. And then you add the mindfulness, then that person becomes more attuned to to safety. Even maybe they have less injuries if they've been doing yoga, because that's another thing you can see. If someone who's already injured, re-injury rates with and without yoga. And because somebody is doing yoga, the problem with research in yoga is people are not necessarily compliant, right, with doing the practice. So that can completely skew what you're doing.
One last question. What is an English translation of Patanjali that would be interesting to read? Swami Vivekananda's treatise? What book did you read?
No, there are a lot of them.
What do you read? What is interesting?
I have the main book with the English translation, right?
Oh, you
So
have the Sanskrit with the English.
Yeah, so there's interpretation. So yeah, there's, so there are some so I actually have this this really good he's a Swamiji, and he's very, very knowledgeable on Veda. So finding somebody who knows the Upanishads and the Vedas, they know that if you want to get into the philosophy, right? And I think it's worth it. It's just so interesting and so fascinating, really, to know how they are looking at the whole thing. So looking at a good yoga course, really getting that, so book-wise, I don't know. I've not really followed a specific text to interpret the sutras.
Okay. Thank you, Jyoti.
Okay. Bye.
Bye. Wait. I think she has to tell a formal goodbye.
Oh, okay.
Yes. Thank you so much, ma'am.
You're welcome. It was a pleasure and an honor. And I enjoyed it.
Thank you.
But I worked really hard, huh?
Very good. It's good to work hard.
Yeah.
Hard work never hurt no one.
Oh, really?
Yeah.
I don't know.
Hey, I think Shanti and Mary must be also listening, by the way. I sent it to our,
Oh, really?
sent it to our class group and everyone.
All right.
Yeah, thanks. Bye. Good night.
Okay, bye.
Thank you, ma'am. Bye.
Welcome. Bye. Nice meeting you all.